Shina? Right. So take your notebooks and be ready. I'm going to give you a lot of tips and tricks and techniques and styles and strategies and approaches. Yep. Right. So we are at hands-on practice. First, we are going to handle with section A. Then we'll take section B. And third, we'll take section C. Based on the suggestion given by some students in the reversal order. Fine. Now here, there are three different parts. Part A, Part B, and Part C. These three parts have three different approaches. Strategies are the same. Strategies are the same, but approaches are different. So how are you approaching these things? Okay, strategies are almost the same. Right. How are you approaching these questions? So first part is fast forward approach. That means fluency is more important. Fluency. Fluency means speed. So the approach is attacking approach. Write down some notes. Somebody, Prabjit, write down the notes. Write down the notes. Okay. So here, attacking. What is the approach? Attacking approach. That means you'll go like racing up, racing up. So that means limited time, minimum time, maximum solutions. Minimum time, maximum solutions. Not maximum time, minimum solutions. No. So this is, you have to apply your talents, skills, speed. Speed. Speed is more important here. You have 15 minutes and 20 questions. And afterwards, it is 45 minutes, 22 questions. Try to understand here. Here, 1 minute also is not there for one question. But there, more than 2 minutes are there for each question. 2 minutes for each question. So that is the difference. Their accuracy is important. Speed is not important because time is there for you. Here, less than 1 minute for each question. So 20 questions in 15 minutes means not even 1 minute per question. Try to understand that. But in second and third parts, 2 minutes per question. Now here, speed is not important. Accuracy is important. Means correctness is important. So how definite you are. Speed will not work there. There is no question. If you want to try fast, you will never get the answer. But here, if you try to take slow motion, here you will not get the answer. Here speed is important. There, speed is not important. That's it. So you are going from fluency to accuracy, not accuracy to fluency. That is reverse angle. Okay. So here, fluency, speed, be a dynamite like that. You should explode very fast. Your think very sharp. So that's it. So we'll start with part A. In part A, you have four texts. Text A, text B, text C, text D. Now here, why these four texts are separated? That means there are four compartments. One train, four compartments. That means they are watertight compartment. This compartment people cannot go into that compartment. That compartment people cannot go into this compartment. That means one is ladies compartment. One is general compartment. That means men and women can all join. One is reservation compartment. Okay. And another one is, you can say, luggage compartment. So here, every compartment has its own label and its own distinct purpose. So that means without purpose, there will not be anything. So you should understand the purpose of the paragraph. If you understand the purpose of the paragraph, that is enough. If you are not able to understand the purpose of the paragraph or the compartment or the text, that means you cannot understand anything else. Because that is more important. If you find out in which text the answer is there, you will save 75% of the time. For example, there is a text regarding diabetes. Now, if text regarding diabetes, then first paragraph may be related to the symptoms and signs of diabetes. Second text may be regarding medication for diabetes. Okay. Third paragraph may be exercises or something for diabetes. And fourth paragraph may be related to diet for a diabetes. So like this, four different things. That means this title, if you understand, it will be very easy for you to go and find the answer and come. So follow that technique. Speed. Speed. Many people try to read these texts. It's a nonsense and waste of time. Waste of time. If you want to buy a soap in a supermarket, if you go and search for the soap, you will be lost and you cannot come after an hour also. So you'll go everywhere and search, and you'll get lost in some places. You'll see what is this, what is that, what is this, and how much it is. You'll see whether it is good or not. So you'll be wasting your time unnecessarily. You want soap, then go, stand at the gate, main door. That is called the title of the complete paragraph, essay. Then you will know what it is, diabetes. Okay, diabetes. Now finished. So this is supermarket. You will know that this is supermarket. Then standing there, look at the main entrance, stand there and see what are there. Oh, clothes, electronics, detergents, groceries. Now what you will do? Immediately you will go here because here are detergents. Then you will go there to the detergents area, stand at the entrance of the detergent area. You will not step inside. Then you will see from there. Okay, what do I want? Yeah, I want bathing soap. So now I see here. Here are washing powders. Here are cleaning powders for tiles and other utensils or something else. Here you have clothes. Then here you have bathing soaps. Then you'll just go to bathing soaps. Then you stand at the entrance of the bathing soaps and you'll see, okay, what are the different types of soaps? Okay, this is Lux, this is Dove, this is something else, this is Hammam. Okay, what I want Dove. So I went Go and pick up Dove. Then go to the session. Dove has the different flavors or colors or designs or whatever. Okay, different lemon, all different things. So there you would select that one. Then you would select the size. Okay. So small one, big one, or medium one, packet one, everything. So like this, step by step, you'll go. So in this case, you are going to save your time. But what many people do is they'll go to the electronics department and they start searching everything there. So they'll get lost. Oh, this is very nice. New type of, okay, mobile phone. They'll waste their time there. So they are lost everywhere. That means that is called madness. Misusing wisdom is foolishness. Mere knowing is knowledge. Practical application of knowledge is wisdom. Lack of appropriate use of the wisdom you possess is called foolishness. So you are Mr. Wise Man or foolish man, that is up to you to decide. So now you have to become, if you are foolish, no problem. What do you mean by foolish? That means we are not wise, that's all. Everybody is foolish in one way or the other way. Madly we do many things. Then, oh, I'm a mad fellow. Many times, many people, everyone will tell like this. So that means you are lost. There is no problem in that one. If you are doing something wrongly, you realize that you are doing wrongly and you have to come properly. So that is the technique. If you don't understand this approach, it will be difficult for you. Now we'll go to strategies. What are those strategies? Skimming, scanning, and surfing. I'm going to teach you those things. That after that, yes. Now we are moving. If you understand this session, then it will be a cake for you. Not even a cake, it's a pastry for you. If you put into your mouth, everything will melt. Like that it is for you. So try to understand the points here very carefully. So what you are going to do is just jot down the points which I am going to tell you. If I tell you synonyms, write down. If I tell you antonyms, write down. If I tell you this word you cannot find anywhere else, listen. Steps I'll tell you, listen. Follow that one very carefully. Because I'm going into the topic now. OET official practice book, medicine or nursing. Yes. Yeah, medicine or nursing, it is the same because we are doing reading. Everything is the same for everyone. Simon Peter. Okay. So what I'm going to do is, I'm going to send you this book in our regular group, OET Commandos. Right. So close the WhatsApp. Okay. Right. Now we are going for part A. Yes. I don't want to show you anything. You select. This time I'm not going to play anything. I'm just giving you straight away whatever majority vote they vote, that only I will take you. Before only I'll tell you. Okay. I told you I will decide. I decided. That is different because The intention is we are facing this. Okay, so attend that one like that one. Okay, now here I'm going, there will be 3 tests in this official book. There will be test 1, there will be test 2, there will be test 3. I'm leaving it to your choice. 7, you have to type only 1, 2 or 3, that's all. Write down only one option. Number only you have to put 1, 2 or 3, but don't submit now. When I tell you to submit, you submit all of you together. Don't submit before. Yes, 7, 6, 5, 4, 3, 2, 1, submit. Whoever is the majority vote, that I will take. Prabjit, count once. Jaisinda, count twos. Adiya Muhammad, count threes. Adiya Muhammad is a very serious student. Mr. Simon, I want you to do something for me. I like that style. She getting, transfer from her side is very difficult, but she has done and she started with great difficulty. She said, I want this means I want this. Okay, 9 for test 3. Okay, what about test 1 and test 2? 2, only 2. Okay, 1 is remaining. Somebody counted 1. 7 for test 1. So 9, 2, 11, plus 7, 18. So out of 25 people, there are some people who don't want to vote also. Very good. Very good. 7 for 1, 9 for 3. Okay, we are taking test 3. That's enough. Right. Test 3 is here. 180. 160. Necrotizing fasciitis. That's what it is. Necrotizing fasciitis. Okay. That's awesome. Now what I'm going to do is these 4 texts. Okay. 1, 2. 3, 4. 1, 2, 3, 4. No. 1, 2. Yes. Extract. Okay, fine. Next one is 1, 2. Yes. Okay, this is for the students' purpose. I'm trying to do something. I'm converting it into Word format so that I can show you big things. This is for your lesson purpose. Okay, so that everything will be in front of you. And I can show you big fonts. So here it is. So what I'll do is export to Microsoft Word. Yeah. Okay. File. Right. Okay. Now we got these things. Yeah, everything will be here for you. I can show you in big sizes. So it will be very clear for you. Okay. We don't want some things which are not required. Okay. Right. This is one, and this is the next one. Okay. So here also, yeah, I'm trying to do something so that it will be easy for you. Okay. This also, this color is very dark. So I'll change it to no. Yeah, no color. I think this would be fine. This would be fine. Now what I'll do is I'll make it, yeah, yeah, layout. Then just bear with me for a minute so that it will be comfortable for you. Layout, orientation, landscape. Yeah, fine. Yes. Okay. Right. That's fine. Yes, that's fine. Now what I can do is font size 26, 28. Okay. So you got the biggest size. Fine. I think it's very clear. Yeah. Okay. Okay. This only little less I'll make so that it will, yeah. Yeah. Okay. Fine. Okay. Uh, okay. 24. Still I have to set the change. Okay. A, B, type 3, type 4. C, text D. Yes. Okay. Yeah. No, it is fine. Okay. So I've got everything here. This is text C and text D. Okay. I'll show you in a bigger font afterwards. No problem. So here you have got everything. Now let us see. I'm going to explain you the points here. First one is, this is necrotizing fasciitis. Necrotizing fasciitis. Now try to understand this particular part here. Here, in this he is very clearly telling you, necrotizing fasciitis is a severe, rare, lethal soft tissue infection. So necrotizing fasciitis is an infection. So he's giving a definition. So this is definition. Necrotizing fasciitis is an infection. So it is a definition or explanation. What is necrotizing fasciitis? That means he is giving definition. Write down definition. You can consider this as definition. So this is text A. Text A. So in text A, this is the title, we know that. So this is the title. So that is the title. OET reading. Right. So try to understand this point. This is the main door. So everything is related to necrotizing fasciitis. Nothing else. Everything is related to this one. That means this is the house of Simon. This is his bedroom. This is his children's bedroom. This is hall. That is kitchen. This is everything like that. So try to understand that one. That means this is Mr. Simon's house. That means everything related to Mr. Simon only. But every room has its own name. So this is completely related to necrotizing fasciitis. That's it. Yeah. Reading part A. So I'm going to give you how to follow this approach. Reading part A. Verse. Hello. 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 Listen. Okay. Now I'm going to take some other point, but I'm just going to give you some suggestions. Okay. I'm just giving you an idea because based on this idea, you will plan that one. Okay. Right. Now, reading subtest. This is latest sample number 3. Okay. That's, we are not bothered about that. I'm just giving you guided reading. What do you mean by guided reading? I am walking like this. You are coming behind me. You also walk like this. That's it. But here I'm going to tell you a practical joke, which I studied when I was in my BA. Once upon a time, there was a great leader in America, and his name was Abraham Lincoln. He was a lawyer by profession, and he came on a tour with his student friends. So he was walking, okay? It was a program from the college, and they were going into the country or the place where Mr. Abraham Lincoln comes from. So they know that Abraham Lincoln is from that particular place. So everyone was going on horseback. Everyone has luggage, books and everything. So what happened? That particular day, they were walking through or going through this particular area, and Mr. Abraham Lincoln was a native of that particular place. So automatically what happened? Everyone looked at Lincoln for any problem. So at one juncture, there was a stream, water pass. So water was there, a free pass of water, expanse of water. Then Immediately everyone looked at Abraham Lincoln. Abraham Lincoln looked at everyone and he said, okay, now this is my time. And what he did, he got down from his horse, okay, removed his clothes with some normal things, and then he folded his pants or whatever it is, removed his clothes, tied them into a bundle, and put it on his head, and then climbed onto the horse. Climbed onto the horse afterwards. Climbed onto the, get me some water if you can, please. Climbed onto his horse, sat on his horse, put the clothes bundle on his head, and started. So everyone what they did, they also got down from their horses. They also got down from their horses, removed their clothes, leaving some bare minimals, bound them into a pack, put them on their heads. They also climbed onto their horse and they started riding the, trotting the horses. And after going to a certain length and almost at the verge of crossing the expanse of water, they discovered that the deepest area of that water expanse did not submerge even the heels, okay, knees of the horse. Then why did Abraham Lincoln do like this? Then they all looked at him. Why did you fool me? Did I tell you to do like this? No. So why you did that? I did not tell you why you did that. Now why are you blaming me? Why are you blaming me? I did. Okay. Why you did? You should have asked me. Just blindly followed. Okay. This is called practical joke. Okay. He wanted to make fun of his friends. He made it. That is why he became the president of America. Because he knows how to make people to do whatever they want. To teach them a lesson that they should not listen to others. Mind you, great people are different. They will make you do whatever you want. They want you to do. Great people do like that. Because they know that they want to prove that you are doing something wrong. Don't blindly follow somebody. If you blindly follow somebody, you will be fooled. And that is what is happening in many situations. Many people are saying, writing, active voice, okay, okay, okay. Yes, it's okay. It's not excellent. Because OET demands passive voice. Go to the official OET. I am not telling. OET is telling. Why are you becoming fooled by others? There is official OET. Why are you blindly following some teachers who are mediocre, who are not at all teachers? They don't have qualification for teaching. I bow down my head to my teaching fraternity. Yes. Those who are really qualified in teaching. I just bow down and pay homage to them. That's what it is. Somebody just comes and tells, I will teach you speaking without knowing their credentials. You are going and paying thousands and thousands. Afterwards, this teacher spoiled me. This teacher wasted my time. They did not teach me. They cheated me. All these things. Why are you fooling yourself? That's the point. Somebody is telling, nobody can teach you reading. Nobody can teach you. Why are you listening to these dumb fellows? You need a teacher for reading. You need a teacher for listening because you cannot do it by yourself. You need to learn the techniques. That's what it is. I'm going to show you now. I told you practical joke. These people are not playing practical jokes to teach you the reality. They are playing with your money. They are playing with your time. They are playing with you. They are trying to fool you, and don't fall into a trap of these people. I am teaching online. Whatever I am telling you, everyone is able to see. I am not telling anything wrong. If a teacher who has to teach 5th grade needs English background and B.Ed English, how can anybody go and teach for adult people, matured people like you? Don't you know? So don't get fooled by others. This is an eye opener for you. Next. Thank you. So this is the latest sample, that is third paper. Hello and welcome to Seven Sentinels. This is Grand Master Class and I'm Peter Simon with you, and on this platform of Classical Corrections, we are here to serve the people, to give the right knowledge and right wisdom and right strategies. We try to give this one because you deserve the best. Sample test 3, reading subtest part A. Just I'm giving you a glimpse of everything. We are not doing this test, but I'm showing you how to do, how to separate management of burns, phase 1 skimming, text booklet. This is number 1. In this number 1, you have, see the bold letters. The first one is burn depth. This is burn depth. This is burn depth. Burns. The entire text is related to burns. Management of burns. Burns, burns, and burns. This is not related to anything other than burns. That means part A, text B, text C, text D. All are related to burns. This is the topic itself. Every passage has a topic and every paragraph is a subtopic. Now this is a topic. Topic means what? Write down, Prabjit. Write down, all these things are important. I want you to put there afterwards for the help of others. I cannot type everything because I'll be closing my eyes almost always because I don't want to miss anything. So topic. Topic means heading or title or subject. I gave you 4 synonyms. In the question, they will ask you, what is the topic? What is the title? What is the heading? What is the subject? What is the context? 5 things I gave you. 5 things. 5 things. Synonyms. These synonyms you will use somewhere else. They will come in the questions. If you don't listen to me afterwards, you'll say, oh, you'll regret. Write down these words. Title. Words will come. These words will come in every time. Every reading you'll get this one. Title. Heading. Topic, subject, context. Title, heading, topic, subject, context. So these 5 words, anything will come. It leads to the main door. This is everything about burns. Now, hand, thumb, pointing finger, middle finger, ring finger, little John. So 5 fingers of right hand. So right hand's thumb, right hand's forefinger, right pointing finger, right hand's middle finger, right hand's ring finger, right hand's little John. So that means every finger has its own name again, but it is related to the main hand. In the same way, topic means hand and 4 labels for 4 different paragraphs. So now I am going to show you here. So this is talking about burn depth. Sometimes they will give you, sometimes they will not give you. If they give you, it is easy. If they don't give you, learn, write down, find out. Burn depth. Burn depth. Burn depth. Now this is talking about the depth of burns. This is talking about the depth of burns. According to the depth of burns, you can see there, 3 types. Burn depth. Based on the burn depth, there are 3 types. Superficial depth burns. Top skin only will be burnt. Top skin means first and second degree burns. First degree and second degree burns. That means epidermis, mesodermis, these 2. Epidermis is first degree burn. If the burn goes into the mesoderm, it is second degree burn. If the burn goes into the endodermis, it is third degree burn. And the bone also is affected. And if first degree and second degree are called superficial burns, because they are not going into the bottom of the skin. Then third degree burns, full thickness of the skin, the complete skin is burnt. The first layer, the second layer, third layer, epidermis, mesodermis, and endodermis, all the 3 layers. So your mind should start thinking like this. And mixed depth burns. That means, what do you mean by mixed depth burns? In some areas, only superficial burns. In some areas, full burns. Some areas only up first degree, some areas second degree also, some area first, second, third degree also. Such types of burns are called mixed burns. So this is based on this point. You're trying to identify. I hope you understand. So this is called classification. Classification of burn based on burn depth. If you see burn depth, you will not understand anything. The title is classifications here. You will see the title burn depth. Read between the lines. A devil is there behind. Okay. You are seeing only burn depth. But I am saying 3 different depths of burns. First degree, second degree, third degree burns. So classifying into first degree, second degree, third degree. Or superficial burns, or full thickness burns, or mixed depth burns. So things are classified. Write down classification. This is related to classification. Now the synonyms for classifications. Questions will be asked on this one. If anybody is in a hurry, just go off, sleep. Enjoy your time. We are learning here. We are not playing the fool. And you are not ordinary people. You are specialists. You are professionals. You are mature people. I cannot play the fool with you. So now coming to the point here, we have classification. Classification means what? Class. We are making into classes. First class, second class, third class. That means groups. First group, second group, third group. Write down groups. Classification. Classes, groups, types. Classes, groups, types. Divisions, denominations, departments, categories, varieties. Differentiation. So these are the words. These words will come there in the questions. These words will come in there in the questions. Which type of burn has even the bone affected? Then where you will go, automatically you will come here. If he says medication, what medication is given, you will not touch this area. So answer is here in your brains. Before going into the text, think with your brain. Practical application of knowledge is wisdom. Instead of applying your knowledge, you are running and jumping. If you use your brain, you will get fast. If you trust your eyes, you will lose the battle. Don't trust your eyes. Use your brain. Think. You have a lot of knowledge. Medication. Where will we find? In text A? No, not at all. Because this is types of burns. This is not related to medication. Never. The question will be in this. This is called judgmental approach. Write down, judgmental approach. If you have a snake, you look for a stick. Yes, yes, and yes. If you see a snake, your hands reach for a stick. You will not ask, give me my rifle. If you see a tiger, you'll say, where is my rifle? You will not take a stick. Are you wise to use the stick for the snake and the rifle for the tiger? That's what it is. That is how you have to be. Beware of that. You have brains, lot of gray matter. God has blessed you. If you do not use your brain properly, you will not get this. Don't trust your eyes. Trust your brain. Brain has a lot of knowledge and wisdom. Use that wisdom. Done. So this is related to classification. Next one. Text B. Text B is talking about, see the bold letters. Fluid resuscitation. Suggested regimen for fluid resuscitation. Resuscitation fluid alone. First one is for adults. Next one is for children. So resuscitation, resuscitation, resuscitation. So this is not related to classification. This is related to resuscitation. For adults different, children different. Resuscitation based on age, minor or major. Minor means below 18, major means 18 and above. You should understand these things. I hope you have to understand this. If and only if you follow this strategy, you will get the answers. So first line, resuscitation. Second bold letter, resuscitation. Adults, resuscitation fluid alone. Children, resuscitation fluid plus maintenance. So differential approach for adults and children, but related to fluid resuscitation. Resuscitation, adults, resuscitation, fluids. That means differential manner of fluid resuscitation for two different groups. These also groups. That is also groups. This is also groups. But these two groups are based on resuscitation. Those three groups are based on burn depth. Remember that. Those are categories. This is fluid resuscitation. This is management for burns. Management for burns. Assess, cooling, control, checking, debridement, application, apply. All different procedures and steps for burns. Burn. First you will assess, then you will cool, then you will control the pain, then you will check immunization, then blisters are there. Then application and everything. So this is management of burns. How are you managing these burns? Step by step. What is the procedure? procedure for management of burns. This is the procedure starting from assessment to dressing the wound area. Next one. So that is related to management. So this is related to burn depth classification. This is fluid resuscitation for two different groups. This is management of burns from assessment till dressing the wound. And this is regarding adult analgesic guidelines. Analgesic. This is for adult analgesic. Adult is there. That means children also will be there. Adult analgesic. Analgesic means what? Drugs. Write down. Okay, sorry. Here you have to say resuscitation. Resuscitation. You should know the synonyms of resuscitation. Means bringing back to normal. Okay. You have to find out these meanings. What are the different meanings? Then management, treatment, procedure, follow-up, and recovery, everything together. The next one, analgesia. Analgesia means medication, drugs, and other things. Then this is children. Pediatric. Pediatric means not children, small children. Pediatric. That is adults. Children is not there. Pediatric is there. Pediatric means what? You can understand. Small children. Okay, for them. Now, let us take these things. First one is burn depth classification. So classification. Second one is fluid resuscitation. Third one is management. Fourth one is analgesia. So categories, part A, part B, resuscitation, part C, management, part D, analgesia. That's it. So that is how you are going to see here. That's how you're going to see here. So simple as that. Now your answers will be based on this one. Now let us see here. Question booklet. Guidelines, instructions. Okay. Age-related considerations for initial treatment. Initial treatment of age-related means adult or children. Initial treatments of burns injuries. Treatment. Age-related. Treatment means what? Management. Management means what? Categories? No. Resuscitation? No. Management? Yeah, management. Analgesia, medication? No. Treatment means management. Age-related. So now you can see here. Age-related management. So see adults, age-related management is in B and D. Initial, final. Initial means what? Initial means what? Now try to understand the question once again here. Age-related consideration for initial treatment of burns injuries. Initial means beginning. Beginning stages. Before he comes to doctor. Or initial, before you have age-related. Age-related, you know age-related where it is there? Adults and children. In B and D. D is what? D is what? Analgesia. That is last stage. So remaining what? Okay. Remaining what? So that is how it is. Now see here. This is D. D is analgesia. No. Management means treatment. Okay. Resuscitation. Resuscitation for adults. Resuscitation for children. Analgesia for adults. Analgesia for pediatrics. If they call you, don't answer. I will talk to you. So, photo na పెద్ద ఫ్రేమ్ చేపించి మంచి ఫోటో తీపినాను అబ్బాయి లాస్ట్ వన్ ప్లీజ్ ఓకే ప్లీజ్ ఓకే సో you can do in Adobe PDF, I think. Okay, so I'm sorry. Right. Categories, classification, management, procedure. There is no adults and no children. Resuscitation, adults and children. Analgesia, adults and pediatrics. So based on that, what you see this question. Age-related consideration. Yeah, here it is. So age-related considerations for initial treatment of burn injuries. Now here, if you see very clearly, age-related is in B, is in D. That's it. Age-related considerations for initial treatment. Initial treatment, starting stages, not final. Analgesia, medication is given by professional after complete assessment procedure, after everything is done, then they will prescribe the medication after considering everything. That is final. Doctor finally gives. But this is not final, this is initial. Initial means automatically it will go to B. So like that you have to think, reason. Next one, the risks involved in certain treatments. The risks involved in certain treatments. Treatment. The risks involved in certain treatments. Where is this treatments and where are risks you have to see. Risks is important, treatments are important. What are treatments and what are the risks involved? Risk means harmful situation, problematic situation. You have to avoid those situations. Where you will go? So that you have to see. Will it be there in classification, burn deaths? You can reason. Will it be there in resuscitation? Will it be there in management, procedure, or will it be there in analgesia? Just assess that. When to start thinking about specialist treatment options? Specialist treatment options. What do you mean by specialist treatment options? Treatment options, specialist. So you have to understand that. Specialist treatment options. Go to C and D. There you see. Treatment informed by patient self-assessment. Self-assessment. He is assessing himself. Where? You'll find out. How to categorize the severity. Categorize. The word category has come here. Blindly put A. Blindly put A. No worry regarding. How to categorize the severity of burn? A. There ends the matter. So I told you already. These words will come. Okay. Treatment means management. Age-related means children and adults or children in pediatrics. Risk, harmful situations. Treatments, managements. Okay. Next one. Specialist treatment options. Options, choices. Treatment is there again. Self-assessment, assessment. Assess. Where is assess? The next one, categories. That's it. Next one, classification of burns, injuries depends on the amount of dash cost. Classification, it is there. Previous question, he told categories. Fifth question will be in text A. Categories. Sixth question will be also in text A because he is telling you, see there, classification means categories. The next one, patients recovering from third degree burns, third degree, first degree, second degree, third degree. It is also category. So where will you find? You will find in A. When evaluating mixed depth burns, so mixed depth burns, where it is? It is also there in A. That's it. Next one, ninth question. You should cool burn injuries by taking off any dash or jewelry that the patient is wearing. Cooling the burns, burn injuries, cooling. That means you are managing. Is it in classifications? No. Is it resuscitation? No. Is it for management? Yes. You are managing, you are not giving medication. You are not talking about the categories. You are not talking about resuscitation here. You are cooling the burn injuries. That means you are managing the burn injuries. You are not giving medication here. So this will be in C. So jewelry should be removed. Then what else will be there? That also should be removed. Patient is wearing. You have to remove. So this is how you have to find out. When cooling the wound, make sure that you don't put the patient is risk off. When cooling the wound, make sure that you don't put the patient at risk. Risk. So where is it? Management. You are cooling the wound. Means it's very hot. It's burning inside. Still burns are there. Flames are coming. Skin is burnt already. It is red. Color changed. Everything. And you are cooling the burns. So where will you get this one? Is it in classification? No. Is it in resuscitation? No. Is it in management? Yes. Is it regarding analgesia? No. So simple as that. The patient may require a dash booster depending on when they were last immunized. Immunization means medication, means injections, means drugs. Booster means what? Drugs. Where will you get? Will you get in classification? No. Will you get in resuscitation? No. Will you get in management? No. Will you get in drugs or medication or analgesia? Yes. You should consider leaving dash undisturbed, as these may help prevent infection. So when you are managing some things, for example, it's burnt, skin is already attached to it. The clothes got burned, they got attached to the skin. Don't pull it up, leave it undisturbed. Or else something else, burns are there, some boils are there, or some pimples like things are there that are burnt, where water is stored inside. Little droplets of water or something, whatever happens there. So that is stored inside. Then you should not put a needle or stick and poke it and make it burst. Maybe. So you should consider leaving dash undisturbed. Any burns or any growths or any developments after your burn, something is there on your skin. Oil falls, some bulb-like things come out. What do you call that one? Maybe I don't know, maybe you know. So you have to leave them undisturbed, because if those are disturbed, then that may cause infection. So where will you get this one? Will you get in classifications? No. Will you get in resuscitation? Definitely no. Will you get in management? Maybe yes. Okay. Will you get in medication, analgesia, or drugs? Think about all this. No. Next one. You should apply ointments. You should apply ointments containing dash to all deeper burns. You should apply ointments containing dash to all deeper burns. So burn is very deep. So you should apply ointments. Okay. So what type of ointment should be used? Containing what? What are the ingredients of these ointments? That you have to write. Will you get in classification? Will you get in resuscitation? Will you get in management? Will you get in the medication? Ointment is what? Ointments, injections, lotions, balms, medication, tablets, capsules, of syrup. All these are related to medications. So now we are going to the third part. So afterwards you can find the answer. In the case of mixed depth burns, again go to first paragraph, first part A. What factor determines the local treatment to give? What factor determines mixed depth burns? What factor determines? Go to mixed depth burns. Okay, local treatment to give. Local treatment. So you have to go there and see there A or B or C or D, just logical reasoning, and you'll get the answer. What is the maximum number of times recommended for attaching a drip at the scene of a burns incident? Scene of a burns incident. Scene of a burns incident. Okay. So now let us classify in a different type. First paragraph is about types of burns. Second paragraph before going to hospital. Third paragraph is during the hospital. Fourth paragraph is after discharging from hospital, after diagnosing and managing. Medication will be given after doing everything. First one is general. Second one is before taking to the hospital. Fluid resuscitation. Third one is management. That means the doctor or the professional is taking care of that. And fourth one is after finishing, medication is given. So those are the stages. What type of burns? What should you go do before taking to the hospital? What will the doctor do at the hospital? And after doing all the procedure, what he is going to suggest? Medications. So that is it. Here in the same way, what is the maximum number of tries recommended for attaching a drip at the scene of a burns incident? Scene of a burn incident, where before going to hospital. So is it one? Classification, no. Is it scene of the burning? Resuscitation. What is the maximum number of tries recommended for attaching a drip at the scene of burning incident? That you have to see there. The next one, how much resuscitation fluid should a child receive? This is also the same thing, resuscitation. Okay. So, next one. How do you know that 15th question? Because he's telling scene, burns incident. Scene of a burn incident, where burns happened there only in the same house before putting him into the ambulance. Local people can give some problem, some solutions. That is what it is. At the scene of the burn incident, not in the hospital. That means before management by the doctor. Okay. How much resuscitation fluid should a child receive per kilo over? So this is child. This is fluid resuscitation. Is it A or is it B or is it C or is it D? Where are you going? You are going to fluid resuscitation, that is B. There, you know child. Where is child? First adults are there, then child is there. Go to child. Then you see 20 number, 20 kilo. 20 number will be there. So see that 20 kilo. Then there only some other number will be there. How much? That number you take and write it. Finished. Don't mind about others. And you're doing sincerely. Let people point out at you. No problem. You do your business. The next one. Before attaching a fluid resuscitation drip to a 9-year-old burn patient, what percentage of the body needs to be? Percentage. It's number. Number is the answer. Write down names, numbers, new words, difficult words, special words and phrases. These are the 5 things which are important. Names, numbers, new words, difficult words, special words and phrases. So you'll find the answers based on this one. Right. The next one. The next point is, so 9-year-old burns patient, not pediatrics here, little bigger, 9-year-old. Okay, 9-year-old burns patient. So before attaching a fluid resuscitation drip means resuscitation related. What percentage of the body needs to be affected? Percentage is number. So 9-year-old. So where will you go? A. A categories, no use. Resuscitation, yes here. And there you will go to resuscitation and check. Resuscitation and check. First paragraph is general. Second paragraph is adults. Third paragraph is children. Okay. So you have to see 9-year-old. 9-year-old means adult or child. It must be in common or it must be in children. It must be in common phase or children. Okay. You have to understand. So there you can see. Percentage will be there. Percentage is the cue. Where percentage is written, you have to see. There you will find the answer. Okay. In children, how much? Adults, how much? You see that. Next one. 18th one. What additional analgesics? Additional analgesics. Where you will go? Will you go to classification? Or will you go to resuscitation? Or will you go to management? Or will you go to analgesics? Automatically you will go to analgesics. And additional analgesic he is telling. Okay. First instance, first time. Moderate level of pain. Then that's it. Additional analgesic in addition. Next one. What route should be used to administer ibuprofen? Ibuprofen is what? Medication, drug, analgesia. Ibuprofen is there. Don't you realize? Synonym he did not give. He gave an example of a synonym. Instead of drug, he gave the name of the drug itself. You are a nurse. If you don't identify that ibuprofen is a drug, it is an analgesia, it is a medication, you are lost. And route. What route? There are different routes. You know the routes. What type of routes? Okay. You should understand. There are two types of route. One is ROUTE route, means the way. ROOT route. That means opposite, a stem. Okay, what route? Blindly you can guess some answers. Maybe oral or intravenous or something else. Okay. Ibuprofen to children. How you are going to give? Okay. Next one. After how long should a patient's pain relief? What is pain relief? Pain relief regime means medication. Pain relief regime means medication regime. Don't you know that pain relief is medication? Don't you know that pain relief is obtained by medication or drug or analgesia? Yes. Pain relief means what? Pain relief. We give medication for pain relief. To be re-evaluated after how long? You should understand that. That is how it is going to be assessed. Now, this is related to part A. Somebody is telling once more. If you have come in the middle of that, no once more. So, but Tirtha, I'm opening your mic. Yes, better. And what do you do is, what I have a break of 10 minutes. Okay. Dal, rice, ready Jesse, please. Okay. Okay, I'll have it. I'll have it. I'll have it. Just give me 4 minutes. Okay. Yeah. Yes. If your reason is genuine, then I'll definitely respond to you. Tirtha. Hello, Tirtha. I want to ask you why you said once more. You can unmute. I gave you a chance to unmute. Okay, I asked the name number. That's what I'm asking you. Okay. Write down 5 different things. Simon's left hand rule. Pentafolia. Some background sounds are coming, so I'm muting back. Okay. All right. The 5 different things are names, numbers, new vocabulary, difficult vocabulary, special words and phrases. Names are easy. Names are vocabulary. Numbers are easy because of their shape. Names because of capital letters. Numbers, you can identify names very easily. Capital letters are there, names. Shape is different, numbers. Size is big. Vocabulary, difficult vocabulary, special phrases. Difficult vocabulary, new vocabulary, special words and phrases. All are big size words. They are very easy to understand. So they are, number 1. I'll show you here. Yes. Yeah, you are going to, this is called scanning stage. In scanning stage, you have to find 5 different things. Names, numbers, new vocabulary, difficult vocabulary, special words and phrases. These are the 5 different things. Okay. You can note it down. These are the 5 different names can be identified by their capital letters. Write down names, a dash, capital letters. I cannot write all these things. You write your notes. I cannot give speed fooding everything. There are people who just want to come and clear OET. For them, I'm not a street vendor. If you really want to learn English, then come. Otherwise, no. So names, how can you identify the names? Names can be identified because of the capital letters. Numbers are very easy to identify because of their shape. New vocabulary are very easy to identify. Difficult vocabulary, special, because they have their size, big size letters. Okay, fine. Now we are going to our session and I'm going to show you those things. Actually, we can do this passage, but I'll give you some other day this passage. Okay. Coming to the point, yes. Right. Now I'm going to ask you one question. Only one question I'm going to ask you. Was this explanation useful? If it is yes, type Y and keep it. Don't submit. If it is no, write N. If it is doubtful, write a D. Okay. So 5, 4, 3, 2, 1, submit. If it is clear, write yes. If it is no, write N. If it is doubtful, write D. That's all. Because if you don't understand this one, we cannot go there. Okay. We cannot go there. So this is burn depths. I told you already, I don't know what I will do when on the spot, I have to decide. You have come to me. I'm doing surgery because something is wrong inside. And after opening heart, I notice that something problem is there. So on the spot, I have to decide. And suddenly I have to take decisions. I am the authority. I am your surgeon. I opened your lungs and I am treating it. I opened your heart and I am treating it. I opened your brain and I am doing the surgery. On the spot, I have to decide. If anything goes wrong, it will be brain dead or heart problem. Heart will blast and something, anything will be happening. I have to decide according to the situation, according to the requirement. I am the authority. If something goes, I am blamed. Because I will be put to task. I am a specialist. People trust me and give the lives of their people so that I can do something on the operation table. And I want to make their faces smile with happiness. So that is what I am doing. I am a doctor. I am a language doctor. Okay, you have vocabulary disease. You have grammar disease. You have pronunciation ailment or sickness. You have sentence construction, okay, disease. There are different diseases. I am the doctor. I am treating it. I know what I am doing. I am an expert for that one. Cambridge University gave me a certificate. I am trying to do the best for you. So that is what I am showing you. Only a person who has command will talk all these things. Otherwise, they will not talk. They'll say, nobody can teach reading. Nobody can teach listening. You go and do on your own. We'll just give you your materials. You take, you only correct. And you only nonsense. I don't know why people are fooling because they themselves are not qualified. I'm not telling that I am great or something. Once again, I'm telling you, you are my beloved children. You came to me for support. I'm doing my best. That's all. I don't want anybody. I don't want any books. I don't want any prizes. I don't want any appreciation. People who come to trust me and give, I will give their best. That's all. Fine. So now we are going to do this one. I'm going to take you. It's going to be a marathon, super fast layer. Let me check. I have already done this long back, maybe 1 year back. Let me check Burns. 1 year back or 9 months back when I was in Amritsar. Reading lecture for the day, management of burns. Yes, here you are. Okay. Right. Fine. Management of burns. Revisiting history. Do not read. Sir Simon's sincere suggestion. Sir Simon's, I am Simon. Sir Simon's sincere suggestion. Do not read. Do not read. Don't read. You are fooling yourself. If you are reading, you are fooling yourself. That means you only have knowledge and you are trying to read and understand. But without reading, you can understand number of things. That means comprehension you are doing. This is called reading comprehension. Not reading like a 5th class boy or a 4th class girl. Matured application of practical knowledge is transformed wisdom. So then we can say that you are a wise man. And if you are not a wise man, that means you are a foolish man. That's all. There is no other option. Either you are wise or you are foolish. Either you are correct or you are wrong. Either you are good or you are bad. There is nothing called half good. One wrong thing also you will do that, you will say, somebody will say that fellow is a very bad fellow. That's it. Just for one mistake, you will be labeled bad. Why? One small droplet of poison in your milk of 1 liter jug, it's still poison. Nobody will have the courage to drink. Poison is poison now. The entire milk is poison. That's it. So be careful. Do not read. And I'm saying do not read. I'm telling do not read. That's all. Don't read. If you are reading, oh, everyone is telling to read fast, read fast. If you are reading fast or reading slow, whatever it is, there are 3 problems here. I am university 8th rank in teaching methodologies, B.Ed, and 1st rank in psychology. Okay, so I'm telling you, I'll tell you good things only. Okay, now let me tell you, when you read, you have 3 problems. First thing is you are wasting a lot of time on reading. Time problem because we have only 15 minutes and you have 4 things. So even 2 minutes for each. 2. 8 minutes gone. Then remaining 7 minutes. What will you do? Go and cry. Break your head. No use. You'll just hurry up and spoil everything. Don't read. Apply your brains. 3 stages of reading. First, you have to do skimming. Then you have to do scanning. Then you have to do solving. Skimming means what? Titles and subtitles. That is what I have shown you. In skimming, there are 2 stages. Titles and subtitles. In scanning, 5 different things. Names, numbers, new words, difficult words, special phrases. Solving. So you went to the title. You went to the particular word. Then in that particular sentence, find the answer. That is the 3rd stage. First one is identify the names of the paragraph and subparagraphs, subtitles. Then scanning. In every paragraph, find out what are the numbers, names, big words, finished. Then solving. You know where that number word is there, go there directly and that sentence, underline, and there you will find the answer. That's it, 3 steps. I already showed you what is skimming. Then I showed you what is scanning. Then I'm going to show you what is solving. That I'm going to show you now. I already showed number of answers there. Just go and find, easily you'll find out. Then next, standard skimming. Study the title, study the subtitles. Study the title, study the subtitles. Then next one, identification of subtitles. Depth. Depth means types. Fluid resuscitation means, okay. Management. Analgesic guidelines. You can see here, this lecture I explained and I taught that one. That lecture I explained and I'm teaching this one. Then names, seriously scanning. Names, numbers, new vocabulary, difficult vocabulary, special words and phrases. Names, capital letters, numbers, shape, new vocabulary, big size, difficult vocabulary, big size, special words and phrases, groups, clusters of words. Now if you see, seriously scanning. Names, capital letters, 50%. Numbers, peculiar shape, 20% answers you'll get. New vocabulary, size, difficult vocabulary, size, special word. For example, what are special words? Extremely sophisticated technological equipment. 4 big words are there. That means it's super special. Answer is there somewhere close by. Names, Abraham Lincoln, A capital letter, Lincoln capital letter. Numbers, 255. 2, 5, 5, different shape, easy to identify. So this is how you will make, scanning makes you easy to locate the related words. Skimming makes you understand which paragraph is what. Scanning makes you understand which word is where. And solving makes you identifying the appropriate answer. Now see here, burn depth. You can see there, burn depth. First one is related to burn depth. Classification, classified, superficial, full thickness, and mixed depth. Classification. Burn depth, classified. Burn depth, classified. Classified means what? Classifications, categories, groups, divisions, departments. All this, they should come like that. When a dancer dances with all perfection, a dancer who does not know how to dance properly blames the floor. Oh, this OET is not good. This OET is making money. They are cheating us. They are all nonsense they will speak. Because that person is a dancer who does not know how to dance properly. So these are all excuses to say that he is perfect, but the problem is with the others. That's how it is. Be careful. Fluid resuscitation. Adults, children. See, numbers are all these green things. What are these green things? Big, big words, names, numbers, all underlined there. And this, I'm just underlined. You need not underline. You'll get it easily. Numbers, see there, 15%, 10%. Easy to identify. Okay, 10 mg, 10 kg, 50 ml. You see there, 50 ml. 10 kg, 100 mg. So 3 ml, above 60 years. Management of burns. Adult analgesic guidelines. So this is regarding adult analgesic guidelines in the beginning, pediatric analgesic guidelines in the last. And this is the table. Table is again classified into 3 dips: mild, moderate, and severe. Classification will come everywhere. So this is classification in analgesia. Okay, if needed. If needed. Okay. Additional means what? All these things are found here. Review in 72 hours means less than 72 hours. Review in 72 hours means after 72 hours. So before 72 hours is moderate pain. In moderate pain, you can review within 72 hours. If it is severe pain, you have to review only after 72 hours. You cannot say. Okay. Addition. Recommended analgesia in addition to column 1 and 2. You can see there. So you'll get everything clear there. In addition. Okay. Which addition? Additionally, where? So it's very clear there. Right. So this is a weekend session. Right. So new batch. My old batch has gone. We have new batch now. So I am taking some students. If anybody is interested, you can contact me. Only if you are serious, you will be selected. If you are not serious, please don't come to me because I'll definitely reject. Please. Right. Now here, these I am sending you. Yeah, I'm going to show you this. How we have done this one, I'm going to show you. And you'll complete the answers. Forward. classical corrections. Yes. Now, Burns. So we are going to do this. They have done all these years. So it is poles. Reading point A. Yes. Okay. Now I am giving you these points. Already gave you all these things. So now I am going to give you the questions. Yeah. So necrotizing fasciitis. Yes. Now get ready. Be in the chat box. Write in your notebook also. Okay. We are going to assess these things now. So write down. This is fractures, dislocations, and sprains. Second, please. Right. So thickness of burns. What was the topic we were doing? Necrotizing fasciitis. Okay. Right. Yes, now I'm going to give you one point here. So, skimming is number one. Number two is scanning. Number three is solving. So, in these three areas, okay, one is skimming, two is scanning, three is solving. In these three areas, which is difficult, you tell me. 1, 2, or 3 you have to type, because those I will explain. Majority vote, only 1 point I will explain. So 1, 2, or 3. Yeah, 3, 2, 1, and submit. Your area, which is difficult, you tell me. Finding the answer. Yeah, we are going to that only, finding the answer now. So majority finding the answer. Okay, fine. Majority finding the answer. Okay, that's enough. Everyone is saying 3. Chitra is telling 33. Wow. Joking. Okay. Right. Okay. Yes. Now what I'll do is, I'll show you both. Okay, here we have, I'm going to show you everything. The drug treatment required. So the word drug is there, and the word treatment is also there. So drug is more important. Drug treatment required. Drug required. Which parts of the body? Parts of the body can be affected. So necrotizing fasciitis. Now, which parts of the body can be affected? Parts. Parts. Body parts. So he's talking about body parts. Affected body parts. Parts affected. Parts affected. So affected parts. Influence. Which parts are influenced for this? The next one. The various ways. Various. Various means write down several. Calories can, the various ways calories can be introduced. So calorie is important. Next one. Who to contact? Who is the contact person? Means professional. To help the patient after they leave hospital. After leave the hospital. Okay. So whom to contact? To help the patient after they leave the hospital. In the hospital, everyone is there. But after leaving the hospital, whom should he contact? That's the point. Then, after they leave the hospital, what kind of dressing? So kind means type. Be careful, words will repeat. Kind means type. It is talking about types of dressing. Okay. How long to give drug therapy? Drug. How long means time. How long means time. Drug therapy. Therapy means treatment. Therapy means treatment. I am giving you synonyms right now. Therapy means treatment. Drug means medication. Drug means dosage. Drug means analgesia. Drug means tablets. Drug means syrup. All these things. What advice? Advice is suggestion to give the patient regarding needle use. So needle use. Next one. Which two drugs? So this is drugs, two drugs you can use to treat. Treat means management. And here Clostridium species. This is very important word. Clostridium. Species of pathogen. So these are the clue words. Clostridium is very big. Very easy to identify. Because big words will be very few. Okay. Pathogen is also a big word. Drugs means medication, treatment. So you have to go to drugs. Which common metabolic condition may occur with NF? Common metabolic condition. See, three big words together. It's a phrase. Group of words, phrases, special words and phrases may occur with NF. Which common metabolic condition? Common metabolic condition. Try to understand this. This is very important, very easy to identify. There only you'll get common metabolic condition may occur with NF. Right, condition, that's it. What complication? Complication means, write down complication. Complication means difficulty, concern, problem, hindrance, disturbance. All these things. Can a patient suffer from if NF isn't treated quickly? So no quick treatment, late treatment, not treated quickly. So this is related to treatment. Quick treatment, immediate treatment, on the spot treatment. If it is not treated, okay. So quick treatment. Complication, if not given treatment immediately. Quick treat enough. The next, what procedure? Procedure. Procedure, where is the procedure? Can you use with a wound if the patient can't be operated? Can't be operated. Can't be operated, can't. Operation is not possible. So what procedure can you use with a wound if the patient can't be operated? No operation, then what do you have to do? There is alternative medicine, alternative method. Okay. What should the patient be told to use to clean an injection site? Injection site. Cleaning. Cleaning means you know what it is. What should the patient be told to use to clean an injection site? Injection site to clean, what should they use? For cleaning, they'll take some water and or glycerin or something in a material. And then they'll take something and put it. What is that called as? What is that material used? They'll not say handkerchief. Okay. Clean injection site. Cleaning process, cleaning procedure. Which two drugs? Name of drugs, two drugs. Two drugs should be given. Can be used if you can use vancomycin. There will be, the answer will be next to vancomycin. When you can't use vancomycin, what are the two drugs that can be used? What kind of insection? This is called scanning. Earlier I told you skimming. Now I am teaching you scanning. What kind of infection should you use tetracyclines for? So tetracyclines, see big word. It is the name of something. What kind of infection For what kind of infection should you use tetracycline? Tetracycline should be used for what type of infection? That means talking about type of infection. You know where the types are there, infection types. Then next one, the average proportion of patients. Average proportion means percentage. Proportion means percentage. Okay, related. Proportion, statistics, percentage, values, figures, data, proportion, percentage, share, data, value, figures, statistics. All these are the words of patients who die, death. Keyword is death. As a result of contracting NH, the average proportion of average proportion. What is the average proportion? 5 or 6 or 10 or whatever it is. So you have to write. Who die as a result of contract. Average proportion. If you take 1 month 7, 1 month 7, 1 month 10, 1 times 6. So make an average and tell what is the figure. That is what it is. Contracting NFH is, so percentage. Okay. Then patients who have eaten, this is regarding some food, may be infected with Aeromonas hydrophilia. See, capital letter is there, Aeromonas. Aeromonas. Okay. Aeromonas hydrophilia. So try to understand how it is written there. So wherever this word Aeromonas hydrophilia is there, it's very easy to find two words up together. So infection also is there. Okay. So these are the keywords. Next, patients with type 2 infection. So type 2 infection, write down, underline. Usually present with infected dash. Okay. Next one, type 1. That is type 2, this is type 1. We already know here. Two types are there. Type 1 and type 2. Okay. Is also known as type 1 NF is also known as what? The patient needs to be aware. So this is talking about knowledge and awareness. Glycated hemoglobin levels. So glycated hemoglobin levels. Hemoglobin levels, glycated hemoglobin. This is called cluster. What do you mean by cluster here? You have to understand what do you mean by cluster here. Cluster means a group, conglomeration, combined, unified whole. Glycated hemoglobin levels. Hemoglobin is a very big word. Hemoglobin you will find there. Not always. One place you will find. Then check there. Where do you find that one, and you can carry on. Okay. Next one, the patient will need a course of what? Okay. Pain medication, pain relief to regain fitness levels after returning home. This is after returning home. Fitness levels. So regain fitness levels. Very important. Regain fitness levels after returning home. So these are the words which you are going to see. If you find out these words, this is very important and this is very easy to identify. Very easy to identify. So I hope you understood what is scanning now. I hope you have understood. Yeah, we are going to do that, no problem. We are going to do that one. Everything we are going to do that one. So now here, Yeah, understood scanning. Understood scanning. We are going to find these things now. Yeah. So there are two things here, NF and Burns, and then another one is also there. Okay, I'm just going to fast track, just 15 minutes, 20 minutes, 15 minutes or 20 minutes. Afterwards, I'll give you the answer. So what you do is write your notebook and write here also. Write in your notebook, write afterwards, you can check how many right answers. Okay, now open Burns. Part A. Yes, this is Burns. So now, write the questions. This is the point. I'll keep it like this. Okay, apart from this one, okay, right. Show you on different screens. 1 second. So hide floating meeting contents. Right. Burns. I'm giving you 4 categories: resuscitation, management, analgesia. So here it is. Yeah. Get ready. I'm going to show you the questions. File, new. Question 1. Okay. Okay. Reading common. Official 3. Materials. Yeah. Right. Yes. Number one, get ready, all of you. Attack. And be careful. Question one. What you have to do is only one thing. Age-related considerations for initial treatment of burn injuries. Now, I am going to, yes. Here it is. Categories, resuscitation, management, or analgesia. You have to check that one now. Age-related considerations for initial treatment of burn injuries. Write your answer there and keep it ready. Right. So 3, 2, 1, submit. I'm taking you there. I'll take you there. So based on your guidelines, I'll take you there. Type there A, B, C, D, whatever you want to write, type there. Age-related consideration for initial treatments of burn injuries. Okay, all of you type and keep it ready fast. Now, yeah. So all of you have written. Check it out. Everyone write it down because I'm giving you practice here. I'm giving you practice here now. Solid practice I'm giving you. Okay. So first one. So majority of you have written B. Now what I will do is, I don't write anything. Write in your notebook and keep it. I'll take you to B. Now B is here. B is here. Fine. B is here. Now let me show you one thing here. Okay. Age-related considerations for initial treatment of burn injuries. Age-related initial treatment of burn injuries. Now let us see here. Now judge, find out whether it is fine or not. Initial. How do you know that it is initial? Initial means one thing. On scene. On scene. Here is the clue for you. Initial means on scene. Yes, here is it. If the burn area, resuscitation. Now here you see intravenous fluid should be started as soon as possible. On scene. On scene means burn scene. The stage where they have got the burns, immediately there only, before putting into the ambulance to take to the hospital, before that. As soon as possible. Intravenous fluids should be started as soon as possible. That's it. As soon as possible. So your answer is here. Check it out. And here you can say age related. What is age related? Adults. Okay. And children. Adults, children. So that is age related. Immediate. On scene. Initial means on scene. Initially on the crime scene or burn scene. That is it. That is initial. And age-related adults and children. So this is how to analyze. You're not going to write any answer. You are writing ABCD. That's all. Okay. Fine. Next. Next. The risks involved in certain treatments. What are the risks involved in certain treatments? Okay. The risks involved in certain treatments. 3 days and class తీసుకోలేదు నాన్న
5 minutes
5 minutes. Okay.
వాడు ఆడ పడుకోండు నీకోసం
ఎందుకు
క్లాస్ చెప్పుకో తిను
Okay.
చెప్తున్నాను ఆడ పడుకుంటా అని చెప్తున్నాను
Okay. 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 I'll eat.
తిను కొంచెం ప్లీజ్
Okay. I'll eat. Thank you. For the cold water that you want. Okay. So, fine. Right. You have written. Now question 2. The risks involved in certain treatments. The risk management, the risk involved in certain treatments. Where do you find this one? Where do you find this one? Check it out. Okay, I'm eating. నాకు కూడా కొద్దిగా చెస్ట్ పెయిన్ వస్తున్నట్టుంది. Okay. Okay, Nana, good night. So, only these 5 questions we'll do, and then afterwards I'll take a break. I'll have my dinner, then we'll start. Okay, the risks involved in certain treatments. These 5 answers I'll give you, and we'll go for the next set. So, the risks involved in certain treatments. So, where will you go? The risk involved in certain treatments is in categories, or resuscitation, or management, or analgesia. So now you have to write ABCD. Submit your answer. 3, 2, 1, submit. 3, 2, 1, submit. Okay, so we have got 9 answers. Okay, C. Most of them guess C. Okay, right. So, risks involved. Okay, fine. Management. Then next. Fine, let us see. Next one is when to start thinking about specialist treatment options. Specialist treatment options. Ordinary are not working. Ordinary treatment are not working. Then specialist treatment, when? So you have to write here. So question number 3. Question 3. Question 3. So write down specialist treatment options. You know what is specialist treatment? 3, 2, 1, submit. These are good people, they'll wait. So all of it together, you have to submit. Right. Some people are not writing, so we'll not wait for them. Okay, question number 4. Treatment informed by patient self-assessment. Treatment informed by patient self-assessment. Now here you have to see categories, then resuscitation, management, analgesia. Yes, 3, 2, 1, submit. Question number 3 over question number 4. 3, 2, 1, submit. Yes. A, B, C, D. Treatment informed by patient self-assessment. Question number 4, treatment informed by patient self-assessment. Okay. Yeah, you have a problem. You have a problem, I can notice. Okay, how to categorize? So question 5. This is the easiest. Question number 4 is the difficult. Okay. So 5. 3, 2, 1, submit. Right. So these are the 5 questions. We'll check these answers. Okay. Now let us see here. Whenever you want to find your answers or any answers, you can just go to the Telegram channel and you say Burns answers. Finished. Just say Burns answers. It will give you. So management of Burns answers. Here it is. So these are the 5 words. Okay, now you can correct your answers. You can correct your answers. You can just correct your answers. Now what you have to do is how many answers are correct answers you can type there. Vinay, how many answers are? Nobody will answer, okay. This is one-way session. One way, not personal, but one way. Everyone is learning personally only. Nobody has the courage to open the mouth. So type your answer. One answer will be very difficult always. So that's why nobody will get 5 out of 5. Okay, if you are 5 out of 5 means expert. Everyone has written this 4th question answer wrong. That's the only place where everyone got wrong. I'll tell you now. I'll tell you that answer. So, B, C, D, D, A. One answer will be very easy. One answer will be very tough. That's what the easiest, the most difficult. So there will be 5 different levels of questions. One very easy, one moderate, one difficult, one very, very difficult. Like this, they will divide. So that is what happened. Okay. Now, coming to the point. 4th question only I will explain. Don't open the mic until I tell you. Okay, now let us see the 4th question. Here. Treatment informed by patient self-assessment. Treatment is given. So how is the treatment going on? The patient will give assessment when it is in the last stage. And who can give self-assessment? Child cannot give. Adults only can give. There is the clue. Small child, pediatrician. Pediatrics, that means small children. Okay, babies who cannot walk, whom you have to carry. Pediatrician. So that one, there you see, they cannot self-assess. Only adults can self-assess. Be careful. Patient self-assessment. Children cannot. So adult children can't. So B or D. B is initial. D is final. B is on the spot treatment. D is after the doctor's treatment. That's what it is. So treatment was given. After treatment was given, patient will be asked, tell me how it was going on. Then that is final, after final treatment. So now let us see here. Patient self-assessment. So you have to see self-assessment is a very big word. Self-assessment is a very big word. So you have to go to self-assessment. Self-assessment is a very big word. So you have to go to self-assessment. Now see here, D. Okay. D. Self-assessment, you can see there. Okay, this is pediatric analgesia guidelines. Not here. Self-assessment. So self-assessment you have to see here. Patient management should be guided by individual case and clinical judgment. Aim for pain scores 4 or less. Analgesia should be reviewed after 70 and adjusted according to pain scores. Who will tell the pain scores? The patient will tell. He is assessing his pain. See here. Individual is scoring it. So, patient self-assessment is assessing his pain at what score? Pain score elicited from patient. See here. Pain score elicited from patient, assessed by patient. Assessment, he elicited, you are eliciting from the patient. Pain score told by the patient. That means he is assessing the pain. Okay. He is assessing the pain. Treatment informed by patient self-assessment. How is the pain? How is the treatment? Everything he will tell you there. Okay. So that is the problem what has happened. Self-assessment. Can a child assess on his own? No. Adult can assess. Adult means where is adult? Second and fourth. Second one is before going to the doctor, before the management of the doctor. And D is after management of the doctor. That's it. So simple as that. Okay. Now, was the practice and explanation useful? If it is yes, you write yes. Otherwise, you can write no, N, Y, or N. If it is doubtful, you said D. 5, 4, 3, 2, 1, submit. Yeah. Now we will go and find out the remaining questions. Based on this style, you do that other passage which I gave you. Take the book. I have already sent you the book, or you have already got the book. Somebody, okay. You can take it from the channels or anywhere and you can practice. So now I want to ask you one thing. How many of you are ready to be available? Because you know, everyone is sleeping. I am dead tired, but still I am there with you. Okay, so I'm going to take it. But I need to know whether you are interested or not. If you are interested, I'll take it. After that finishes, I'll take part B also. Okay, after that finishes part C also. I'm ready to take. Where your patient ends, we'll stop there. I'm patient till tomorrow morning, 6 o'clock. If you want me to sit, I'll sit. Word given is word given. I'm there for you. But you have to decide on your own. If I don't eat my lunch now, my son will trouble me now. Okay, he'll say stop everything. So how many of you are ready to be available after 15 minutes? Because I want to eat. You also can have breakfast or something. So now you can say, if you are ready, type YES, yes. If you are not ready, type NO, no. Type NO, no. And I'm not going to discontinue this one. The video will run. What you can do is, you can write your comments and your request. Your comments and your request will be considered. If you are silent, I cannot do anything. Write your comments. Number 1, requests. Sir, I want this one, I want that one, I want whatever this. I face a difficulty in part B, I face a difficulty in part A, I face a problem with vocabulary, I face a problem with synonyms. If you have a problem with synonyms, I'll give you a synonyms list, which will come in the exam. If you have vocabulary, I'll give you those things. Okay. So 5. So all are ready. Okay, fine. Most of them are ready. So now you can write and you can type. 15 minutes gap. You go 10 minutes, prepare tea and come back and write something. Now you write something and go back or just do something. But all your doubts are there. I'll go ahead with that one. So write down what problems you pour out your heart. It should squeeze my heart and bring it out so that I can explain you more. But now, more than requests, I want you, whether you understood this part A or not, how you feel these sessions. Do you think that this is a waste of time or is it useful? I'm going a little faster now, okay, because I started already the basics. So I'm going a little faster. So after that one, yeah, we'll join 15 minutes. And I don't want to chat anybody with anyone else. You can just write anything you want on the screen here. Mute all. No, not mute all. I have something to do. Yeah. Vijay, yeah? Vinay. Vinay, are you there? Unmute, please. Vinay, unmute.
Hello,
Yeah,
sir.
Vinay, are you able to follow?
Yes, sir. Yes, sir. I'm just following you, sir.
Yeah,
Everything
are you
I
able to
understood.
understand?
Yes, sir. Very much, sir. Very much.
If I take one-on-one session, no, my time
Yes,
will
sir.
be wasted and your time will be wasted. I let everyone enjoy. You understand now?
Yes, sir. Yes, I understand,
This
sir.
is like one-on-one only. Nobody is speaking, right?
Yes, sir. Yes, sir.
I'm teaching you alone only. You are on the other side and I'm on this side. You can see
Yes,
me.
sir.
That's all. Nobody is coming. Nobody is disturbing. So we are
Yes, sir.
working hard.
Exactly.
That's all. Okay.
Exactly, sir. Exactly.
That's it.
Thank you very much, sir.
No worries. No worries. You're welcome. You can. Okay.
Please
Mute
have
me.
some food, sir. Please have some food.
Yeah. I have to. Otherwise, I cannot continue. Okay. Then
Please.
take care. 15 minutes. Type whatever you want, your request and other things. Oh my God. Yeah, we are starting in 3 minutes. Okay. So back to the pavilion. So now we are going to the second set of questions. Classification of burn injuries depends on the amount of dash caused. Classification of burn injuries depends on the amount of dash caused. So now first point is, only when I tell you write answers, otherwise don't write. Now here, classification of burn injuries depends on the amount of dash caused. So burn injuries. So classification. So now what you have to do is, again write question number, same style. What you did in the first part, same style you have to do. You have to do. Without doing, you cannot find the answer. You have to blindly guess where it is coming from. Question number 6. Okay. Now you tell A, B, C, D. Come on. 3, 2, 1. Submit. So right. So come on. Whoever is there, try to type, because I'll take you there. Based on the majority vote, I'll take you there. If everyone says A, then I'll take you A. First, if A is wrong, then I'll take you to C, whatever the other persons wrote. So based on that one, and I'll show you how it is right and how it is wrong. Right. So taking to A, yeah. This is A. You now check it out. So here, classified based on what? So 1, 2, 3 are classifications. But classification based on what? Will not be in 1, will not be in 2, will not be in 3. So classification outside the box. So it will be, you check there. And now I'm going to give you the second option. So, right, you have gone there. Now, submit your answer 6. 5, 4, type and keep it ready. Don't submit. 3, 2, 1, submit. Sixth answer. It is there in front of you. You can submit your answers. So the question is, classification of burn injuries depends on the amount of dash caused. Depends on the amount of dash cast. Yeah. You can type your answer now. One, two, and three are divisions. Divisions based on what? It's the beginning only. D. Mosase. What do you mean by damage? Which damage? Damage for what? Damage for brain or heart or whatever it is. It's incomplete answer. Srilata, you have to write small letters, not capital letters. Okay, fine. Next. Now let us check this answer. If it is right, you can put a tick mark. That is correct. Tissue damage. Tissue damage. Yeah, right. Not injury, tissue damage. Okay, fine. Next one, we are going to question number 7. Now let us see question number 7. Question number 7. Yeah. Patients recovering from third-degree burns are likely to experience a great deal of shrinkage and dash of their skin. Shrinkage and dash, and before and after, and. So where you have to go, 1 second. Now what you have to write is, okay, question number 7. A, B, C, D. What is your answer? Question number 7. Where you will go? A, B, C, D. Patients recovering from third-degree burns are likely to experience a great shrinkage and dash of their skin. 3, you have to write A, B, C, or D. 2, 1, submit. 2A, 2C, 3A, 3C. What about the others? 3A, 3C. Okay. Okay. Now again A. So find 4 A's. Okay, now let us go there. So classification of patients recovering from third-degree burns. It is patients recovering from third-degree burns are likely to experience a great deal of shrinkage and dash of their skin. Okay. Management we have seen, or the different types of. So here it is third-degree burns. So let us go to A because 4 people have written A. Yeah. So A. Third-degree burns or full thickness burns. It is there. Answer is there. Third-degree burns. You see there. Now what you are supposed to do is don't write anything. Write and keep it. No problem. Write and keep. No problem. But when I tell you to submit your answer, that time only you have to submit. Okay. So you see there. So 5, 4, 3, 2, 1, submit. What about the others? I gave you the clue word, but still you don't. And is the clue word there. And means one before and one after. In full thickness burns, you will have only one and there. In the 4 sentences, see there. So shrink means contract. And the contract is before. And after and what is there? That is the answer. So simple as that. Contraction. Contraction means what? Contract means expand, contract, expand, contract. So contraction means shrink. Shrink is already there. So he has given you a synonym and you did not understand. And next to that word, the meaning is there. The answer is there. Contraction means a shrinkage, diminish in size. Write down. Synonyms we don't know. Synonyms we don't know. Learn. If you don't know the synonyms, you will not get this answer. Contraction means a shrink, to depreciate in size, to minimize in volume, become less in size. Those are the meanings and synonyms. Otherwise, you will not get this answer, please. So, contract means a shrink. So, you have to be very careful there. So, he has given contraction, which is a synonym of shrink. Shrinkage, contraction. So, one word is there. After that, there is and. After and, there is blank. That blank is nothing but scarring here. See there. So that is scarring. Scarring. So simple as that, very simple. If you know the synonyms, it's very easy, dead easy. Okay. And moreover, you have nurses, you can guess a lot of things. Next one is question 8. Question 8. When evaluating mixed depth burns, that is the third one, you should take into account how the burn looks and whether there is a dash in the affected area. Okay, whether there is dash in the affected area. Now, what are you supposed to do? So A, B, C, D. You type and keep it ready, then I'll tell you, then you have to submit. When evaluating mixed depth burns, you should take into how the dash and there is in the infected area. A, B, C, D. 3, 2, 1, submit. Okay, now we'll go to A then. Dash in the affected area. Mixed burns. Okay. Where has text A go? Yes. Mixed depth burns. So once again, I'm showing mixed depth burns is here at the bottom. So see the question once again. When evaluating mixed depth burns, you should take into the account how the burn looks. Looking means what? And afterwards, and is there. And is very important. Huh? Whenever end is there, end is very important. Before and, there is no dash. After and, there is dash. That means burn looks, appears. What are the other words you have to imagine? Looks means appears. Okay? Or appearance. Or visible or visibility, like that. Some other words will come. Okay? So here, and whether there is dash in the affected area. Whether there is dash in the affected area. Yes, you can see that. Fixed depth bands. So how do you know the words? Once again, I'm telling you, how do you know the words? So remember, I did not ask you to write the answer, please. Hold on. No hurry. Everyone has to get a chance to think. If you write, others will stop thinking. That's why I'm trying hard to not to make anyone write earlier. Okay, here, evaluating. First, learn these things. These are very important. Answers anyone can tell. Evaluating. What do you mean by evaluating? First, write the synonyms of these things. Evaluating. Evaluating. Assessing. Valuing. Examining. Observation, noticing, something like that, related words. Not exactly, but almost the same. Okay, evaluating. The next one, you should take into account how the burn looks. Looks means how it appears. Okay. And whether there is something in the affected area. And is the keyword. Before and is looks, after and is something. The places may change also. And is very important. In mixed burns, you have to go. And then you have to check and. Mixed depth burns, sorry. Mixed depth burns. Okay, I have to clear all these things. Okay. Yeah. Yeah, you can see there. Mixed depth burns. You can see the first line of mixed depth burns. Burns are frequency of mixed depth. The clinician should estimate, underline. Estimate means assessment, evaluation. Estimate means evaluate. Yes, I'm sorry. So here, it's very clear. Burns are frequent. The clinician should estimate. And okay, that's the point there. Okay, that's the point. So here, estimate means measure, evaluate, assessment, evaluation, assessment. Then next, measure, evaluate, assess. Then next, estimate. Estimate is also the same thing. So now, what is the end presence of? Okay. Yes. When evaluating means whether there is a dash in the affected area, whether there is dash. Okay, whether there is dash. So that one word you have to write here. Something in the affected area. So now, check it out. I'm keeping the answer here. Nobody will write before. And everyone gets the chance to find out the answer. And that's why I'm counting 7. Okay, 5, 4, 3, 2, 1, submit. Submit. Next one. Next one is question number 9. You should cool burn injuries. You should cool burn injuries by taking off any dash or jewelry that the patient is wearing. So this is what? Now 4 things are there here. So these are the 4 things: categories, resuscitation, management, analgesia. So categories, resuscitation, management, analgesia. Whichever you want, you can take here. So these are the 4 things. So now where will you get categories or resuscitation or resuscitation, oral fluids you are giving drip, and then management, then analgesia. So now you have to write. Okay. Now what are you supposed to write here? Question number 9. Question number 9. Okay, you have to write A, B, C, or D. Okay. So where will you get this 9th answer? You should cool burn injuries by taking off any dash the patient is wearing. The patient may be wearing what? Something you know. So 3, 2, 1, submit. Okay, management. So we'll go to management now. We'll check it out. Yeah, this is management. Cool, cool, cool. Where is cooling you see? Where is cooling you see? Now cooling, which point? 1, 2, 3, 4, 5, 6, 7, 8, 9. Okay, submit your answer. 1, 2, 3. Don't submit the answer. Tell where it is. Cool. Okay, cool. So, and then you have to remove something. So don't write answer, write which one, which point answer is there. 1, 2, 3, 4, 5, 6, 7. Any one number you write. Any one number you write. 1 to 7 points are there. Which point answer is there? Write that point number there. Yeah, 3 is there. Very good. Okay, 3 is there. That's what. Follow it up with me. I'm taking you how to go there. Reading all these things is nonsense. Nonsense only. Those who read these are mad fellows. That's all. There is no other option. Okay, that means they are not wise enough. They are not wise enough. I'm not telling anything wrong. Opposite of wisdom is foolishness. Lot of knowledge is there, but you are not using means foolishness. Using means using practically. Benefit means it is wisdom. Okay. Fine. Now, so now you have to remove something. So what you have to remove? 7, 6, 5, 4, 3, 2, 1, and submit. Srilata, what is the spelling of clotting or clothing? Okay. So there are 2 answers. Okay. So already here it is there. But here also there is an option called, I'll show you. Again, whenever there is end, try to understand. Okay. You should cool burn injuries by taking off any dash or jewelry. Here he has used or jewelry. So wherever jewelry is there, or is there. Similarly, there will be another word instead of or, some other word also may be there. What is that word? You check. And before one word, after one word. So here he has given you very clearly. Okay, what is that he has given you very clearly? Or, after or jewelry is there. But here we will see how it is there, jewelry, before or after. Okay. Now, remove jewelry or hard clothing. So here you see jewelry is before, not after. Okay, or hot clothing, or is the word here. So or is there, or is going to help you. If or is there, or is going to help you. Or is going to help you. Is already gone. So that is how it is. Before R one word, after R one word. Before R is jewelry, after R is hot clothing. Finished. So what you have to write, you have to know. But some people have written spelling mistakes. That's also a problem. You have got the answer, but what is the use of that? Okay, now let me show you. So here, Kavita, hot clothing, right? Srilata, your spelling mistake. It's not clothing. It's clothing. You wrote double T instead of TH. That's the problem. So you lost that mark. I will not give you. I know. I will not give you this mark if I am in the exam. I am correcting the paper. Next one, hot clothing. Hot clothing, hot clothing, hot clothing. Again, Vinay also wrote clothing. I don't know. Two people wrote clothing. It is clothing. CLOTHING, clothing. Apply your wisdom. Okay. Yeah, it's a mistake means mistake. Whether you accept it or not, it's a mistake. Okay. So accepting is the first step. So then automatically next time you'll be very careful. If Simon sir says, okay, okay, then again in the exam also you'll write like this and you'll lose your mark. Some people say spelling is not a problem, it's okay. Yeah, it's okay. Only when one condition, when your pronunciation is understood through your words, then only it's agreed. Next. 10th question. When cooling the wound, make sure that you don't put the patient at risk of something. At risk of something. Of something. Some risk. Or risk of something or some risk. What is that some risk? 10th question. When cooling the wound. When cooling the wound. So when cooling the wound. Question 10. We are going a little fast now. Question 10. Question 10. When cooling the wound, make sure that you don't put the patient at risk. So what you are supposed to do is here, you have to write A, B, C, D. Okay, A, B, C, D. Yeah, 3, 2, 1, submit. So you are going to see. So when cooling the wound, make sure not at risk of something. What is the risk of something? So risk of something, go there. Yeah. Risk of something when cooling. Risk of something. What is? Yeah, check it out. Yeah. Cooling. Risk of something. Risk of something. Risk. Risk means what? Risk means synonyms will be given. Synonyms will be given. Same word will not be there. Risk word will not be there. If there is a risk, what should you take? Okay, like that. What should you do? If there is risk, what should you do? So you can think like that and you can use it. Now you have got the answer. Now this answer is in which section? 1 to 9. So 1 to 9. Where is it? 1 to 9. Which point it is there? Come on, write down fast. Up. Type fast. 1 to 9. Which one? Okay. Next. Type fast. Make use of it. Make use of your brain. I'm making you to learn, not passive listening. Many people, when they listen, no, they don't do anything, then they'll forget everything. Those who listen, they'll never forget. They are already clear the marks. Okay. Fine. So now, submit your response. 5, 4, 3, 2, 1, submit. Care should be taken. Taking care not to cause hypothermia. Okay. Be careful of spelling mistakes. Okay. Cool the wound, not the patient. Don't cool the patient. Cool only the wound. taking care not to cause hypothermia. If you cool the patient, it will become hypothermia. That's what it is. So there is a risk of hypothermia. Hypothermia. That's it. There is a risk. Next one. That's fine. Next question, number 11. The patient may require a dash booster. Booster means what? Depending on when they were last immunized. Immunized means what? Immunized means what? Question 11. A, B, C, D. Write down. Question number 11. A, B, C, D. Write down A, B, C, D. A, B, C, D. So you say it is D. Okay, now let me see. The patient may require a dash booster. What is the name of that booster? Depending on when they were last immunized. So D, last immunized. So A, B, C, D, you check there. So now, the patient may require a dash booster. Okay, last immunized. Depending on when last immunized. Okay. Now here, I'm taking you to D now. Yes, this is D. Yeah. Depending on last immunized. Last immunized. Yes. Last immunized. Depending on last immunized. Okay, I'm taking you to the question once again. Yeah. The patient may require a dash booster depending on when they were last immunized. Booster, immunized. Booster and immunized. Booster and immunized. Okay. There is the answer here. The patient may require a dash booster depending on when they were last immunized. Okay, 10th question we did not answer, no? Okay. So 8th also I did not explain. See here. 8th is sensation. 9th is hot clothing. 10th is hypothermia. You're fine. Next. The patient may require a dash booster depending on when they were last immunized. So I'll take you to the page number D. Right. Here it is. Last immunized. Now, we go on there. We went there. And next. Okay. Submit your response. Okay. 7, 6, 5, 4, 3, 2, 1. Submit. Okay. Now let us check our answer. Okay, you can submit 7, 6, 5, 4, 3, 2, 1. Submit. Submit your answer. Type your answer. See, this is why paper should be in front of you. You have to go far, you have to come back, you have to go far. You'll lose your mind and concentration. Okay, that's why you have to print papers and you can practice. Okay. The patient may require a dash booster depending on when they were last immunized. Yes. Submit your answer. Last immunized. Yes, come on. So check it out. So now here, what is the booster that is required? Depending on, yeah, immunization status, that is management of burns. Check immunization status. Point number 5. Okay, it's management. Last one is analgesia actually. Okay, last one is analgesia. Right. Drugs and medications. Okay. Now here, check immunization status and update tetanus if necessary. So another booster, update tetanus. Okay, if necessary, checking the immunization status. Okay, fine. That's fine. So there will be one question which will be confusing you. This is the last question like that. Out of 20 questions, this is the toughest one. So you have to understand that one, what he's telling. So check immunization. That is what he told us here. So this is for all management of burns. You will use this in a step picture. Okay. Medications are different. This is immunization. Okay, immunization is different. It doesn't fall into medications. Okay, next one. It is preventive measure. Okay, tetanus. Next level. 12. You should consider leaving dash undisturbed as these may have help prevent infection. Preventing infection. Something should be left as they are. After burning, when you are cleaning everything, before that everything happens, you have to consider leaving something undisturbed. You should not have touched that one. Let it be like that. Don't make any changes all of a sudden. Many people will tell many different things. You don't bother. So you think which is the best one. So you should consider leaving dash undisturbed as this may help prevent infection, preventing infection. That will go to management. Then let us see here. Yeah. Prevent infection. Prevent infection. See there. So 1 to 9 points. C is over. Which point is the answer? You have to tell now. So the next one is 1 to 9. Which is the right answer? 1 to 9. Right? Just write the numbers. You see there. What is it telling? Okay. What is it telling? See there. Okay. Now, there you can see. Okay. That is 7. Yes, 7 point is right. 7 point is always right. Okay. 8th point maybe sometimes future expected, but 7th is always right. Okay. So now you have gone there to the seventh one. Now what you are supposed to do is submit your response. 7, 6, 5, 4, 3, 2, 1. Submit. Submit. Yeah. Next. So next question. 13. You should apply ointments containing dash to all deeper burns. You should apply ointments. Apply. You should apply ointments. Ointment is what? Okay, management, a treatment. Okay, you should apply ointments. Treatment, yeah, management and treatment. So, fine. Question 13. Question 13. A, B, C, D. Question 13, A, B, C, D. A, B, C, D. 3, 2, 1, submit. So you are going to see. Okay, now let us going to see again. You should apply ointments containing what? What is the what are the constituents of the what are the contents of this? That's it. Okay. Now let us go to here. Okay. So now here 1 to 9. Type which one you will find the answer. 1 to 9. 1 to 9. 1 to 9. 1 to 9. Okay. So write down which is the right answer you feel. 7 students have written. They wrote 8. Okay, 8. Very good. That's I appreciate it. Okay, only don't write because somebody has written. That's cheating. So now, don't write the answers here, some mistakes before writing. Before I tell you, please. If you cannot follow for small things, how can you follow for big things later? So next one is, so submit your response. 5, 4, 3, 2, 1, submit. That is how you have to be. Don't write before anybody. Okay, this is the rule. This is the name. This is the game. Okay, that's why you'll be happy when everyone gets the same answer and you get. If you copy and write, or if you write before, they'll copy and paste. What is the use? So that is the point. Spelling, okay. Somebody wrote antibiotic. No, Vinay, you are mistake. It's not antibiotic, it's antibiotics. Yeah, next one, question number 14. Question number 14. Question number 14. Yeah. In case of mixed depth burns, what factor determines the local treatment to give? Local treatment. Mixed depth burns and local treatment. Local treatment where initial treatment or final treatment or medication or what it is exactly, where you will find this answer. So that is how it should be. So 14th question, A, B, C, D. A, B, C, D. Yes, 3, 2, 1, submit. Yeah. So A, Majority of you have written A. So local treatment. Which factor determines the local treatment? So let us see A. Okay. In case of mixed depth burns, local treatment. Okay. Local treatment, where it is you see. Go to mixed depth burns and go to local treatment. I hope you got the answer. So definitely it will be easy. So now you just okay. Oh, I'm not able to bear much. Okay. So go to A. Next, submit your response. Okay, 5, 4, 3, 2, 1. Submit. 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 Okay. Oh. Yes, 12th one blisters, 13th one antibiotics, 15th one thickness. Okay, thickness. Okay, thickness. Now let us see burn thickness, whether it is right or not. Let us see. Local treatment should be based on the burn thickness at any specific dice. Thickness only. It should be thickness only. Okay, burn thickness. We are talking about a burn only. 3rd degree burn is already there. Okay. Should be based on the thickness. Burn thickness only. We know that it is burn thickness. So thickness is enough. Burn is unnecessary word. You lose this mark. You will lose this mark. I don't know. So here, right. Try to understand that point there. So 2nd and 3rd degree burns. Burns is already here. So no need of burn thickness. Only one thickness. Based on thickness only. It's understood. Okay. You will get the mark. But maybe no also. Okay. Fine. Next one. Because it is there, that doesn't mean that you have to write that one also. If it is necessary, only write. If in the question it is already there, no need to write. Next one. Next is, what is the maximum number of tries recommended for attaching a drip at the scene of burns incident? At the scene of burns incident. So this is question number 15. Question number, question 15. Okay. A, B, C, D. 5, 4, 3, 2, 1. Submit. Okay, B. So number of tries. B is number of tries. So let's go to B. Yeah. Okay, number of tries. How many tries? Check it out. Number of tries. Again, I'll take you to the question. What is the maximum number of tries for attaching a drip at the scene of a burn scene? Scene of a burn incident. Scene of a burns incident. Scene of the burn incident. Okay, so based on that one, you have to go to B. So now we are going to B. After going to B there, you see How many times drip? That's what it is. See in there where you will find first part or middle or last. Find out. So find out that one. Then next. Okay. Now submit your response. Fine. Submit your response. 5, 4, 3, 2, 1. Submit. Two. So where it is, you see here. Here. Although transfer should not be delayed by more than 2 cannulation attempts. 2 cannulation attempts. That's it. So two trials. So fine, that's very clear here. For 2 cannulation attempts. Yeah. Cannula attempts. You can write that. Next. So that is in the B. Okay. Sorry. So how much resuscitation fluid should a child receive per kilo? Okay, per kilo. How much resuscitation fluid should a child receive per kilo? Over 20 kg. Remember this 20 kg. Where will you find this one? That is important now. Question number 14. Question 14. A, B, C, D. Yes, 5, 4, 3, 2, 1. Submit. Okay. Type down your answer. B. Okay. How much resuscitation fluid should a child receive per kilo over 20 kg? Over 20 kg per kilo, how much he should receive? Okay. How much fluid should a child receive per kilo over 20 kg? There you have to see. So, fine. So, there you will go to B. Yes. Said B. Yes, B is here. B is here. Fine. How much resuscitation fluid? Okay, about 20 kg. Is it B? So let us see here. How much resuscitation fluid should a child receive per kilo over 20 kg? Okay, 16th question. So what is the answer you have written? B. So I will take you to B. Okay. So how much resuscitation fluid over 20 kg? Okay. B. Okay. Here it is. How much resuscitation fluid is required? You see there. above above 50. 1 minute. See the question once again. The clue word is 16th one. The clue word is per over 20 kg. Per over 20 kg. So you have to see over 20 kg. Yeah. What will we do there? That is important. Over 20 kg. How much resuscitation fluid should be given? Over 20 kg. Yes, over 20 kg. Where is 20 kg? You see there. 20 kg should be there. Right. So that you have to notice. Give for the first time on 10 kg body weight plus 50 ml per kg. Yeah. Okay. How much resuscitation fluid should a child receive for over 20 kg? Yeah. So 20 kg. 20 ml per kg for each extra kg. There you see. 10 kg body weight plus 50 ml per kg for the next 10 kg body weight plus 20 m each extra 1 kg. So that is what you have to do. Now here, yes, submit your response. 3, 2, 1, submit. And Ramjul for first 10 kg body weight plus. Okay. Now let us check some answers. Yeah. Here it is. See the slide now. Okay. Now you can submit your response. Yeah. Submit your response. Yes, this is 2 and this is 20 ml and 17. 17. Yeah. Before attaching fluid resuscitation drip to a 9-year-old burns patient, what percentage of the body needs to be affected? 9-year-old boy. What percentage is important for a 9-year-old boy? Okay. For a 9-year-old boy. Question 17. Question 17. Okay, what percentage of body needs to be affected? Yeah. So it's A, B, C, D. A, B, C, D. A, B, C, D. 3, 2, 1, submit. So which paragraph you have to go, which part you have to go here? So fluid resuscitation dripped a 9-year-old bird's patient. So if it is B, so let what percentage of need to be affected? So let us see B. Yes, B is here. Now submit your response. Yes, I'll be counting. 15, 14, 13, 12, 11, 9, 8, 7, 6, 5. Done. So submit your response. So 10%. Okay, fine. So you check there in children above below 9 years of age. So where you have to go? So B. Okay, you will get the answer also. Submit your response. Okay, that is 10% finished. Okay. Next questions. So submit these things like this. What are the answers you have written? 10%. Okay. Next question. Okay. 17th question. Over 18th question. What additional analgesics is recommended in the first instance for a patient with a moderate level of pain? Moderate level, less pain, moderate pain, high pain. Like that one we can take. So what analgesic is recommended first instance for a patient with moderate level? So 18th question. Okay. Question 18. Question 18. So recommended first moderate level. So fine. Categories no. Resuscitation no. Management no. Analgesia no. Which one? Which one is the correct answer? A, B, C, D. You can say A, B, C, D. Which one is the right answer? You can tell. Based on that one, we'll go forward. Now, next one. Submit your response. Submit your response. Yeah. Submit your response. I told you to write A, B, C, D, and somebody is writing some words. Huh? Somebody is writing some words. Don't use. Okay, next one. Okay, here it is. Huh. Okay, now find out the answer. Submit your answer, please. Okay. So to check like that. Okay, 1, 2, 3, mild, moderate, and severe. Mild, moderate, and severe. So you can see. So pain scale 7 to 10. What you have to do here? Okay. What additional analgesic is recommended in the first instance for a patient with a moderate level of pain? Moderate level of pain. Okay. Moderate level of pain. Okay, fine. Okay. So end on 2 to 4 hourly as needed. Okay. Submit your answer, please. Tramadol 50, Endol. What about the others? Huh. The next question. Sorry. Okay. So that is it. Tramadol. Tramadol. So like this you have to differentiate. Next 4 more questions. Oral. Okay, sorry. Tramadol. Next. 2 more questions. Okay. Okay. Uh, Okay. Uh, okay. So question. PDF. Yes. Okay. Right. 18th question. 19th. What route? What should route should be considered? What route should be used to administer ibuprofen to children? So, right. Okay. What route should be used to administer ibuprofen to children? Children, adults. What route should be used to administer ibuprofen to children? ibuprofen, not resuscitation. So go there. Okay, where you will find administer ibuprofen to children. So go to which part you have to realize. You have to realize. Question 19. A, C, D. So these are the four options. Write down any one. Right. How many of you written only one answer? Okay. Okay. Yeah. So let us go there. Let us go there. No. What route should be used to administer ibuprofen to children? Ibuprofen to children. Now, what is the answer? Submit. Submit your response. Submit your response. Yes, orally. Okay. Ibuprofen orally. Okay. Vinay, you are not supposed to do all capital letters. Then after how long should a patient's pain relief? Question number 20. Question 20. Question. No need to say sorry. Question 20. Because you did not wanted it to do. If wanted you to do mistake, then okay. Question number 10. After how long should a patient pain relief re-evaluate? Re-evaluate means reviewed. Okay, we have no problem there. So question number 20. A, B, C, D. Where you will find this answer. 3, 2, 1. Submit. Okay. D. Okay, last question. After how long should a patient's pain relief regime be re-evaluated? So question number 20. Okay. Question 20. A, B, C, D. Right. Submit the response. A, B, C, D. After how long? Should remember. So, write down the answer. So next, submit your response. 7, 6, 5, 4, 3, 2, 1. Submit. Okay. Now I will give you the answer. Okay, 18 to 20. 18 to 20 for 72 hours. 72 hours. Okay, sorry if you Simon sir is tired. Rest. Okay, tomorrow is mock test. How How many of you are interested to complete one mock test today? Okay, please say yes. No. Hmm. So now I want you to message. Okay, how? Okay, what score for this demonstration? What score for this demonstration? So 1 to 10, or you can say 0 to 10 scale. What score you give? Score per session. Yeah, I'm giving you 1 minute. You can write feedback regarding this session. Tomorrow I'll take part B and part C. Part B and part C. Now, scores, please. Total out of 20. How many marks you got? You tell me. And then submit your feedback. We can follow it up. Sri Lata 17 out of 20, new student. Very good. Next, Reshma 16 out of 20. Very good. So Vinay 16. So now I am unmuting. One by one, you can share your experience. So one by one, you can share your experience. Yeah. Yeah. Now coming to the point. Anne Mary. Hello, Anne. Okay, D. Musase. Hello, Musas. Who is this Galaxy 470? I don't know the name. Jacinta. Hello, Jacinta.
Good evening, sir.
Yeah, what did you learn today?
Sir, today it's a good class, sir. I understand a lot, sir.
Yeah, what did you learn? 2 or 3 points, please.
The synonyms, everything in the detail you explain in explanation, sir.
Okay. Next. Very
Thank
good.
you, sir.
Yeah. Then next, Jyoti Sridhar. Jyoti Sridhar.
Hello, sir. Good evening.
Hello, Jyoti. What did you learn today?
So I learned how to go to a paragraph without reading all the details. It's really very not necessary. And how to solve the problem, how to solve the question, and locate the answer, and always know the synonyms, which is very important.
Right. Very good. So, any doubts?
No, sir.
Okay. Try this examples like this one. Then, Madeline. Hello, Madeline. Okay. Hello, Reshma.
Hello, sir.
Yeah. What did you learn today, Reshma?
Actually, I learned one new technique to easy to find out the answer, and it's very helpful to for time consuming and to learn the synonyms also.
Very good. Excellent.
It's very wonderful class, sir.
Others write one or two sentences. Okay. If you have any requests or anything or suggestions, you can write there. Tirtha.
Hi, sir. Good evening.
Good
Yes, sir.
evening, Tirtha. Yeah, share your experience.
Today's class was very nice, sir. Because before I never scored like more than 15.
Okay.
That was it.
Yes. Fine. So how
Yes,
many you scored today?
sir. 16, sir.
Okay, fine. So right, very good, excellent. So we are going to start a new session from Monday. So anybody who is interested, they can approach me. Only serious students. Otherwise, please stay away. Don't come and disturb us. We are hardworking people. We don't have people who want to play the fool here. So they have to work hard and do. Okay, they don't give time. There is no meaning. Okay. Next one. Srilata.
Good evening, sir.
Good evening, Srilata. How are you?
Good, sir. Thank you, sir.
Yeah, can you share your experience, please?
Yes, sir. I heard of this skimming and scanning, but I haven't known what it was exactly. But in today's session, I think that was very clear to me, and how to trace the answers within short time. That was time. It was time consuming for me earlier in the few tests, but I think now I will be working on the same agenda which you have told me. So I'll be working on that. I think this is really well explained, sir.
Vinay, all of you can write one or two sentences feedback, okay, in the chat box. So that,
Hello.
okay, Vinay, yeah, carry on.
Yes, sir. It was really nice class, and I come to know lots of things which I was not aware about it. And it seems like if I'll practice like that, then I might increase my score, and I think I can do that definitely.
Yeah, of course. Ashley Thomas. Hello, Ashley. Okay, anybody has anything to say, you can mention. Otherwise,
Sir, actually, I just want to know, is it necessary to start our answer from first question, or we can start from 7 as well?
you can start from wherever you want. But do you know that from 7 onwards to 20, it depends on the style which you do test number 1 to 5 also. Okay.
Okay, sir. Okay, sir.
That is the point. Anything you can do anywhere you can do, but if you go in orderly fashion, it will be easy for you. So quickening.
Okay, sir. Okay, sir.
Okay, then. So next, anybody else, you can respond. You can send your message. Okay. Okay, fine. Right. I have just traveled for a long time, and we came home, and directly I started the session. I thought I'll manage, but yeah, you people need all these things, so I explained in detail. I cannot just give you fast food, your hands and your. So tomorrow we'll see. Tomorrow is a mock test actually, but if anybody finishes the mock test, clear we can do. Okay. So one reading, one listening, one writing, and 2 speakings we have to do tomorrow. Mock test. And those who do not complete mock test tomorrow, please don't attend my sessions for 3 or 4 days. I'll not give you the links, and even if you come also, I'll not accept inside. So try to complete the test. Okay. Gina. Yes. Okay. Bye-bye. Good night. Anybody has to speak anything you want to speak, you can speak. Okay. Otherwise, that's the end of the session. That's the end of the session. Good night.